All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this is a random chit chat. And Steve, yes, you once again, you are the first one. Steve is first, then Jim, Sino second. Jim was second as well. Third, third, okay, fair enough. Sajeev, welcome. David, welcome. John Snyder, welcome. DDS, welcome. Melanie Goodman, welcome. And yes, Melanie, just when I was hanging up, I saw your message that I forgot to say like, subscribe, and share. So for the previous video and this one, please like, subscribe, and share. There is a link for Patreon in the description. There is also a link for buying me a coffee. And there is a link to support this channel in general if you like the work I'm doing. So thank you very much. And here we are. Yes, we are all back. Absolutely, Barbara. Welcome. Hello again, Jody. I haven't seen Japan for some time. I hope he's doing okay. Melanie, question. What J&J use as a placebo? Very good question. So let me show you. So here, if you see, this is J&J coronavirus, our commitment to transparency. In these studies, ensemble studies, half of the participants will get a placebo instead of the AD26-CoV2S vaccine. The placebo looks just like the AD26-CoV2S vaccine and is given the same way by injection shot, but the placebo contains no active vaccine. Using a placebo in the study allows researchers to see potential difference between the investigational vaccine and the placebo. Placebo study will be the placebo in these studies will be sodium chloride, also known as saline water. So it is water. It's normal saline. Interesting that they observed more people having side effects with saline. But anyways, that is what they have. All right. So good question. Kamran, so Kamran Jamil, you were actually the first one on the Patreon, so thank you very much. Are discussing different antibody tests today? Not today, but let's take that up. So OSC says, can I get a different booster vaccine from different manufacturers? In theory, you can. Again, I have touched on this one question before as well. As long as it is just the coronavirus related SARS-CoV-2, all vaccines are going to be able to add to the immune system's behavior and boost it. So yes, it can be taken. I think majority of the concern will be dosage. That if the first dose, the same vaccine companies have done dose adjustments to say, okay, this much dose after this many days will produce this kind of immune response. So when we mix and match and when we change the windows of dosage, then these are administration of a drug outside of the trial data. And so that is almost like no trial and you just start giving the data. That is one concern. The second concern is there are some folks who are not comfortable with all kinds of vaccines. For example, adenovirus-based vaccines are manufactured, most of them are manufactured in the fetal tissue copies, cells copies, and so some people do not want it. Although the adenovirus in India is not made in the aborted fetal tissue, they are made in the tissue from monkeys. So these are the kind of concerns that may be there. Simple Garden says, Kamran, you're welcome. Simple Garden says, gosh, my internet went down. Pasi says, Dr. Bean, put the spider nose links on Chit Chat 6 on Facebook, including 3 research papers about the technology. So I think that you had sent it. I will actually use them and talk about them as well. Tomorrow I want to talk about Sputnik, and then day after we'll talk about this. I think so. Steve says, I think the vaccine distributors have so far been given only one manufacturer's vaccine. So if you go back to the same place, it should be the same. Yes. So far, in one place, there is just one manufacturer. You're correct. Terry, thank you very much. Paul says, how many vaccine cases after 49 days? Would one expect a severe case with that number of post 49 vaccinated COVID-19 cases? So according to the article, so I haven't looked at the data. According to their article, after 49 days, there was no severe cases, there was no hospitalization, and there was, of course, no deaths. Yes. Sepal Steve says, have you heard about ECMO versus ventilation? Yes. I have seen ECMO is quite an invasive method, and I have actually seen much more people dying during ECMO because ECMO has to be run by by good experts. You're pulling the blood out and then you're cleaning and bringing it back, or you're oxygenating and bringing it back, and so there are more chances of mishap. Although the idea is great that if the lungs are not functioning correctly, you bring the blood out and you oxygenate it and you bring it back and you take the load off of lungs. And so that is a great idea. But one of our own internal medicine professors who was put on ECMO died even after ECMO. Frankie says, what is the significance of the blood type and severity of the disease? Frankie, I have discussed that. So please look in my channel, Blood Types. Basic gist of the idea is the following. There are some blood types in which they have a tendency for blood thinning. They have the blood coagulation factor 8, which is less in them. Because of that, their blood is thinner compared to other blood types, which causes them to be a little bit less at risk of COVID hypercoagulable state compared to others. But remember, not everyone develops hypercoagulable state from COVID. So that means not everyone of that blood type is just safe. They're not safe. It is just that some chances of lesser severe cases. So Judy says, what is the antibody pathway? So Judy, we talked about it in Johnson and Johnson discussion before. So what happens is it is an adenovirus that arrives in our body, goes into our cells. The cells get the DNA, the nucleus. Then we make the messenger RNA for spike proteins. Spike proteins are formed. They are broken down in the cell. They are shown on the cell surfaces, and the immune system responds. In Johnson and Johnson case, both T helper 2 and T helper 1 pathways engage. That means antibodies are formed and cytotoxic T cells are formed. However, their cytotoxic arm becomes stronger in this vaccine compared to antibody arm. Judy, is that sufficient, or would you like me to draw it as well? I'm okay either way. Denise says that I have trust issues with J&J with their numerous lawsuits, such as for ovarian cancer. Yeah, so I still have to look at the data itself to see what data showed. At least when I showed you the data here, for me, what is interesting is that NIH is also looking at the data and reporting back. I still need to see the full document, but this is NIH. Again, some of us would say that, hey, we don't trust NIH either, and that would not be a misplaced distrust. Kirk Samuel, thank you for the super chat. Hi, could a variant like the South African mutate independently within two separate populations and show up as the same variant when sequenced? not exactly 100% same, but we are seeing that the Hong Kong variant, South African variant, Brazilian variant, UK variant, they had some mutations that were similar and then some that are different. So having a variant becoming 100% same in their mutations is difficult. So Audra says, will there be a titer of the COVID vaccine, or how often do you think we will need to get revaccinated? So, Audra, I really am hoping that there will not be a need for revaccinations. So, once people who are getting infected and becoming part of the herd immunity, then a number of other people who will become vaccinated and become part of herd immunity, I don't think SARS-CoV-2 is going to be as bad as it is. It is probably going to live with us in our throats for a longer time, just like other coronaviruses live with us. And it would probably cause some mild cold here and there, but I don't think it would cause too much of an issue in the future. Yes, I realize it that those who are not infected or who and recovered, and those who are not vaccinated may still be open to the infection, and that will could go to the severe cases as well. So I believe that for those who do not want to be vaccinated, at least some ivermectin, vitamin D levels, and so on. In general, we all will have to become stronger in our own ways, whichever ways we feel fit, and then combat it. But this virus is not going to be with us forever. It does not have the capability of drifting and shifting like flu virus has. So as much as this has caused destruction, the destruction that it caused is not because it is actually more dangerous than flu. And I know that when I say this, some people are going to just perk up their ears and say, all right, here comes Mubin saying it's not more dangerous. What I mean by that is we all were empty vessels for this virus. For flu, a majority of us have become exposed to it in our lifetimes. So many of us are protected from flu. That is why flu cannot cause havoc like SARS-CoV-2 is doing. But once we become immunized to SARS-CoV-2, then it will also become just as noise. And it doesn't drift and shift like flu. So it will have to go away. A simple garden says, considering there may be waning of antibodies from wild virus, would JNG be a better choice for those who have had wild early in March, April? You know that even when there is waning of the antibodies, your memory cells are there. Having said that, there is nothing bad after so many months. There is nothing bad to get J&J or others. These would only act as boosters and kind of activate your immune system once more. So nothing bad in it. But if you have infection today and then 2 weeks later you are going to go and get vaccine, that does not make sense. Mikavelli, we'll talk about Sputnik tomorrow. The virus will go away when we are allowed to take ivermectin. Believe me, if we are allowed to take so somebody, I talked about Fauci yesterday, and somebody put a comment, and I do not know if I have ever let on my political leanings because I never wanted to. So please, it's not politics when I talk about Fauci. I talk about Fauci more from a medical leader's point of view. So somebody had put a comment out that, well, Fauci was under pressure, and I understand he was under pressure, that his science was not listened to. But now he's not under pressure then. Did he come out and said, you know what, guys, I'm not under pressure. I am free now to talk science. Everybody go get vitamin D. I am going to make vitamin D level tests. I'm going to influence the people around me and make the vitamin D tests available. I'm going to make SARS-CoV-2 tests available. You don't have to have a prescription to go get them. Do you see any such thing now? Or it is the same song as he was singing before? It says, what is the difference in his no pressure? So again, I think I'm just not a fan of him, regardless of his politics. I think he himself does not call himself political, meaning he can work with any administration. Same way, I am not political when I'm criticizing him. I just am not a fan of the way he behaved. And he is behaving. So, fine, he was not behaving good before because people had pressure on him. What about now? If he's not under pressure, he should have come out the very first day and said, I am not under pressure anymore. I can tell you, go take vitamin D. I can tell you, go take ivermectin. NIH, please start working on ivermectin trials. Start administering ivermectin. Did you hear any such thing? Somebody is saying that I'm a pumpkin head. All right. So Judy says that your drawings are fabulous. Please draw if you have time. Definitely. Let's look at it. So the question, Judy, that you had was about the T helper 1 and 2 pathways. So let's do that. So what will happen is that when the vaccine is injected, so let's say this is the Johnson & Johnson vaccine, and we have the adenovirus. So this is the adenovirus from Johnson & Johnson. This adenovirus has the DNA for the spike protein in it. Then we fuse that virus with our cells, or this virus has the capability to fusing with our cells and get in. Once it gets in, it goes and gets attached. So what happens is it is brought in, then its spikes are removed, and we start chopping it up, and then whatever broken limping virus is left, that comes in and gets attached to nuclear pores. It doesn't come in by itself, it is actually brought in, it is trafficked, it is commuted on a protein which is called kinesin. Kinesin protein's job is to haul various materials within the cell. So these are like the trucks within the cell that move things from one place to another. So kinesin brings it to the nucleus, then it attaches the remainder broken adenovirus, gets attached to the nuclear pore complexes, and over here it injects the DNA pieces it is carrying in our nucleus. Inside the nucleus, this DNA is then translated into messenger RNA. That messenger RNA is brought out in the cytoplasm. In the cytoplasm, that messenger RNA is then connected with the ribosomes. Ribosomes take a messenger RNA and they would make spike proteins from it. So those spike proteins, so let's say here is a spike protein that is made, and there are multiple spike proteins. These spike proteins cannot be secreted out of the cell. They cannot escape from the cell. They are shredded by our endosomes. Endosomes are like thrashers. They would just pick up the proteins. So this is an endosome. And endosome is just going to, have you seen shredders, the tree shredders? So it is going to shred this protein into smaller pieces. Then those smaller pieces are loaded on MIC1 or 2 and then presented on the surface of the cell. So once that happens, then the immune system comes in and starts working. So here is the naive T cell. Naive T cell that comes in, it doesn't know what its life is for. It's just a naive cell. And if you release interleukin 12 on it, which is usually brought in by the innate arm cells like macrophages or dendritic cells and so on, if you secrete interleukin 12 and dip this naive T cell in interleukin 12, then it would take the pathway of T helper 1 cell. It will become T helper 1 cell. It would transform into that cell, and then it would cause the cytotoxic T cell to become activated. So this is the cytotoxic arm. We have seen that cytotoxic arm, when that is activated, it causes less severe storm or almost no storm. So if a vaccine is going in this pathway, then the vaccine's own effect is going to be less severe, plus the cytotoxic arm is going to be strong and would combat the virus. On the other hand, if we have absence of interleukin 12, or presence of interleukin 4, then the naive T cell becomes T helper 2 cell, and that is also a helper cell. That helper cell will take a B cell and convert it into a plasma cell, and this plasma cell would start creating antibodies. So it would create antibodies. These are the antibodies that we would then have. And many of these cells, this helper T cell, this helper T cell, this helper T cell, this helper cytotoxic T cell, and this plasma cell, they all will become memory cell as well to fight with the virus in the future. So what they're saying is, Johnson & Johnson, that our dominance, the immune system's behavior, is dominantly driven towards Th1 compared to Th2. Because of that, there is less chances of ADE, and because of that, there is less chances of cytokine storm or severe effects because of the vaccine. So hopefully that helps, Judy. Okay, so what else do we have? What did I miss? So, Kamran, Jamil, this is the holy grail. Do you know that we actually do not know exactly what moves the naive T cell to go towards T helper 1 or 2? Although we say that when IL-12 is present, then it goes T helper 1 pathway. The question is, why is IL-12 present with this vaccine and not with the other vaccines? So these are the kind of questions that are still open, and this is, in general, for immunology, this is open. There are many theories, but there is no known reason. If we knew what moves it to T helper 1, other than knowing that there will be interleukin 12, if we knew it, then we would actually make things that would move it that way. There are many diseases in which the immune system mistakenly goes to the pathway where it should not go, and we have no way of moving the immune system back from taking that pathway. So good question. We know about cytokines, but we do not know exactly what causes the immune system to move towards one path compared to the other. Simple Steve says, just read that there is a variant of the virus that is not affected by any of the vaccines. Have you heard about that? Not yet. So let's see. If I Google it, SARS-CoV-2 variant not affected by vaccines. WHO, they have actually put that as an ad so they can be looked at, but they have the least useful information. Mutation in SARS-CoV-2 variant does not affect vaccine. Could we undermine vaccines? So, the growing threat of viral 5 days ago, although it's not strictly proven, most vaccines believe that maybe makes it unlikely. Steve, if you can give me some link. Gio Ramos says, if I have a sore throat, should I start taking ivermectin or wait for my results? So the not prescribing, I'm not your doctor, so I can't prescribe or advise you. For my own patients, I start them ivermectin right from the beginning. CJ, is there any info that J&J vaccine works in the UK variant? They haven't talked about UK. They've talked about South Africa and Latin America and US because that is what they used in their trial. These are the countries where they did the trial. Trevor says, how possible is it that COVID will mutate to escape all vaccines? So I have done this discussion before. Let's do it once more. Let's actually look at let's mutate it ourselves. So let's say here is a SARS-CoV-2, and it has these spike proteins on it, correct? And the SARS-CoV-2, it is very happy today because it can bind with our ACE2 enzyme, correct? And then binding with the ACE2 enzyme, it can actually then enter our cells, correct? It can come in and then it can do whatever it wants, destroy them. Now let's see how can we create mutations in it that can escape this this whole thing. First thing that can be done is that this spike protein develops a mutation that it still binds with ACE2 receptor but does not allow the vaccines to work. And how would that happen? If we look at the spike protein itself, so let's say this is the spike protein. Spike protein has multiple structures. One part of the spike protein is the receptor binding domain, this part. That is where it actually binds with the ACE2, here. So the first thing that the virus will have to do is change, because the vaccines are producing antibodies that are against these areas. Virus will have to do something that it still can bind with ACE2 but not allow the vaccines to work. It is doing that with some of the vaccination mutations, that there are spot changes that defeat some vaccine antibodies, but it still has to work. So can it mutate away from vaccine? Impossible in this current situation. Now, let's try to make it possible. Let's say what this virus does is it finds an altogether new spike protein structure that still binds with the ACE2, but somehow does not bind with the vaccines antibodies. Not really possible. Another possibility is that, let's say, instead of working with the ACE2, it changes its structure and now it works with, let's say, DPP4, some other receptor. But for that, we'll have to wait for hundreds of years or maybe decades for it to kind of swap out its SARS-CoV-2 protein. Another possibility is this, and this some bacteria have known to do it, and that is what they do is they change their structure in a way that, let's say, here is the binding area and the whole remaining structure of the spike protein is changed. So the binding area is here, that still binds with the ACE2, but all the remaining structure, all of it has changed shape and its electromagnetic powers are changed and the amino acid patterns are changed and so on. Again, to get to that level, it still has to do a lot of changes. And it has to make sure that the receptor binding domain stays efficient and available. So once again, to say that can it actually get out of the vaccine's behavior? Very difficult. Vaccine's efficacy can drop, but it's not going to come out of vaccine's trap. So, okay, so there is a side discussion. Judy says very clear. Thank you very much. So Pasi says that Eker's MP4 receptor for SARS-1, or what was its name? DPP4. So that is a possibility that, let's say, SARS-CoV-2, Pasi, somehow borrows the receptor from SARS-CoV-1, but then it has to really wholesale swap out its receptor binder and borrow it all the way from SARS-CoV-1, and would be a difficult thing for it to do. John Scott says, question, adenosine changes T helper 1, T helper 2, and this accounts for severe combined immunodeficiency from adenosine deaminase deficiency. Is this how C19 succeeds? I do not know that if that is the mechanism for C19. Although, if you think about it, as much as when we go T helper 2 pathway with the SARS-CoV-2, we have more tendency of cytokine storm, but we are still fighting it. Not everyone is falling to it. So that means antibody pathway is working fine as well. It's just that the cytokine storm and chances of deaths are more in that pathway. The T helper 1 pathway, so far, people stay asymptomatic and or mildly symptomatic and still fight this. So the chances of death or severe storm or probably long hauling state are less over there. Okay, so MERS bind with DPP4 and SARS-CoV-1 bound with the, let's see, SARS-CoV-1 receptor binding. So the RBD of both SARS-CoV-1 and 2 spike proteins do bind to the cell at ACE2. So I think MERS binds with DPP4. So SARS-CoV-2 will have to figure out something else or borrow DPP4 from MERS. Leslie, I did not see the question about the severe allergies. Can you please ask again? Mark says Luffy's on his catnip position like an opium smoker. Lol. Yes, he was quite happy with catnips. So Pasi has a good comment here. SARS-CoV-2 501Y V2 escapes neutralization by South African COVID-19 donor plasma. So Pasi, I would actually submit that donor plasma issue has been out there from the very beginning. What is happening is there is a subtle immune thing that I have never actually discussed it. So let's do that today. And that is, let's see if I can, I think we are ready to look at that as well. So let's see. Here is a B cell or a T cell, a cell that can bind, adaptive arm cell, not innate, that can bind with an antigen. So let's say here is the cell. When the cell is produced, at that time, the genetic material in the cell that makes the variable region of the antibody. So let's say here is the antibody. This is the variable region, antibody. The variable region of the antibody is made by randomly rearranging the genetic structure here. This is called somatic hypermutation. So what happens is, imagine if my fingers, each finger is one amino acid magnet, and I have 5, normally there are 5 to 7 binding places. Let's say 5, just so that I can use my hand easily. Now, not every B cell will have the same 5 finger structures in the same way. If that was the case, then every B cell can only bind to one kind of antigen. What happens is that when the hand is being developed, the binding area, variable region, then these fingers are mutated. So in some B cells, the fingers become something like this. In some other B cells, they become like this. In some B cells, they become like this. In some B cells, they become like this. So they keep changing shape. And so every person has a different shaped variable region for their B cells. That is the beauty of it. So your B cells and the shapes they can produce are going to be different than my B cells and the shapes that we will produce. That means when SARS-CoV-2 appears in me, it will have, my antibodies will be there, and I'll make hundreds and thousands of antibodies. A lot of them are going to be unique to me because my B cells have learned to work that way. When I bring that plasma to you, it is not necessary that the same antibodies, all of them in the right quantities, become available to you, and the same combination is there to attack the virus. So it works, but it doesn't work all the time. There are 2 factors. One is the donor's shapes, and then second is the recipient's own state. Maybe they're getting out of the viral state and they're getting into the cytokine storm and so on. So this is one. And then, of course, Now, a third factor in there is the virus that is changing its shape as well. So, all because of all of that, convalescent plasma is not a very successful technology compared to polyclonal antibodies or vaccines. Convalescent plasma also has a problem with the scaling as well, but in general, monoclonal antibodies and convalescent plasma, although convalescent plasma is actually polyclonal antibodies, but still doesn't work in all cases. Yes, absolutely, John Snyder, like Legos. But the thing is, all of us have different patterns. Paul is, you're correct. Priya, more cases, more mutations, also tens of thousands of variants to start with. Absolutely. And everybody who gets infected makes more mutations. Some of those mutations are just useless. They cannot, the virus is not even viable anymore, and so it dies. And some of those may be more lethal or more spready, as we are seeing. Renee says that any thought on fluvoxamine and how would it possibly have. So Renee, I would do a discussion about fluvoxamine. I have to yet look at its mechanism of action in COVID. Kellen says I want Oxford and Novavax. Oxford, AstraZeneca, that is Spike. Novavax is Spike as well. I would have the Novavax first if it is efficacious, because it is just a spike protein, no messenger RNA, no DNA, nothing, no adjuvants. And then maybe a vaccine that may be the inactivated virus. Share is actually, Share, are you promoting other channels? Okay, so I will have to dig it up and share it again. John Snyder's. We had to try basic convalescent plasma to see if it worked. Yes, you're correct. And convalescent plasma works in many cases. It just, if convalescent plasma was successful, we would have seen a lots of use for it. Logic, welcome. Original cool gang. People are here. So France is not here, but majority of the folks are here. Kevin says, if you all would keep my daughter and her household in your prayers, significant other just tested positive, daughter, and hopefully she will be fine. I hope they keep their vitamin levels correct. If they can have some access to ivermectin, talk with their doctor as well for that. Yes, I have a video about Novavax, correct. Marie says, how can a person who is not taking immunosuppressants drugs know how strong or weak his immune system is? Don't know. That is a problem. What you can do is you can see vitamin D levels. You can look at your own history of allergic reactions. You can see if you ever needed to have Allegras. You can see your parents, if brothers, family, brothers, sisters, others, did they ever have any allergic reactions? So these are the kind of things that we can do. However, the tests for immune system, specifically reaction to SARS-CoV-2, still are not built. Gamer one says, my father is worried about taking vaccine, will interact with his heart medication. Tom Moore still wasn't vaccinated from UK because his pneumonia medication, dying as a hero from the NHS. Normally, vaccines do not interact with other drugs because vaccine is going to just cause the immune system to work. Vaccine itself is not a drug to go have drug and drug interaction. If you think about it, most of the time, if I share my screen for a second, the drug-drug interactions happen for in many ways, but some of the ways are the following. One way is that, let's say this is a liver, and in the liver, so this is a good happy liver, And let's give it a, let's hit Shanghai. Now, in the liver, let's say there is an enzyme that is working on a drug, let's say drug A, and it breaks it down into smaller pieces. So the function of this enzyme is to metabolize, to break down that drug and eliminate it. Now imagine there is another drug that comes around, drug B, and it also starts using this enzyme for its own metabolism. Now the enzyme number are limited. So they are now overwhelmed because now they have to work on two drugs. And the result is that they cannot give time to both drugs fast enough. And so drug A is now sitting around saying, all right, work on me, break me down. And meanwhile, drug A will continue to do its function. That is one drug-drug interaction where drug B has caused drug A to stay longer in the body. And that drug A, for example, let's say if it is blood thinner, then it would continue to thin blood for longer time. If you take more dose of drug A, now you are over accumulating the drug. On the other hand, B can come in and accelerate the function of this enzyme and eliminate drug A faster than expected. And all of a sudden, the therapeutic levels of the drug are gone. A. This is one way of drug interaction. Another way of drug interaction is that here is a cell, and cell has a receptor for a drug, let's say nicotine. And the drug comes in here and comes and binds with the receptor, and there is something that happens inside the cell. Now imagine there is another drug that comes and binds with this receptor. Remember, for example, ACE inhibitors or ACE receptor blockers and so on. So there is another drug that comes in and fills the nicotine receptor. Now nicotine is not going to find its place to work, and the cell is not going to feel that nicotine is there and will not do its function. That is also drug-drug interaction. Then there are some drugs, for example, many of the time are drugs when they are moving in the blood, they usually hitchhike on albumin. Albumin is a protein that you can say is the workhorse inside our blood vessels. It carries things around. And most of the drugs, when they come in, they would hug albumin and just sit on it and ask the albumin to give them a ride. So they'll go someplace where the drug's concentration is less, and then they would come off of albumin and go and do something there. Now, there are some drugs that stay with albumin for a longer period of time, or they come and displace other drugs from albumin, increasing their concentration, free concentration in the blood, and allowing their action to become increased. That is another drug-drug interaction. And so on. There are drugs that directly interact with each other. There are drugs that would interact with each other's enzymes. So many things can happen. Vaccine doesn't do any of these things. A vaccine, let's say here is the deltoid muscle. So this is the muscle. Vaccine is given in the muscle, and it is immediately picked up by the cells here. The dendritic cells, the macrophages, the fibroblasts, and so on, muscle cells, they are going to pick it up. This is vaccine is at most is going to go to the lymph node sitting in macrophages or dendritic cell, or maybe some of it will flow to lymph node with lymph, but it's not going to go into the blood. Imagine these are micro doses. Then it's not going to go and interact with another drug to cause some problem with the liver or other things. So usually vaccines do not cause drug-drug interactions. David says, I have to ask this. I am an ICU nurse in South Africa working in COVID ICU. People in my country are buying ivermectin for animal use, the injectable, and they're applying it topically on their skin, on the fatty parts like the thighs. I cannot see how a drug that must be given subcutaneous then absorbs through the skin. And if it does, how much is absorbed? And is there any studies of ivermectin tablet for human use may be given by our doctors after the courts yesterday gave order? So, David, yeah, so a drug that is supposed to be subcutaneous, rubbing it on the skin would create a very tiny amount of absorption. and so it would not work. The reason that the absorption is going to be very tiny is that our skin, so um, if I can draw it here, our skin is made up of multiple layers, correct? And the deeper we go in the skin layers, the cells are more living and dividing, but the higher we go, superficial we go, the cells are more dead. So if we apply things here on the top here and we rub them and rub them and rub them, they very tiny amount is going to go all the way down here. Very tiny, almost negligible. So applying it on the surface is not going to do much. Now, this is important that it becomes available for doctors to use it. So DD says, is anyone coming up with the inactivated virus vaccine? So yes, so the India's vaccine, I always forget the name. That's so bad of me. Let's see. India's vaccine. That vaccine, even yesterday, folks had to Covaxin had to tell me COVID vaccine. So Covaxin. Covaxin is a inactivated virus. Is Covaxin inactivated virus? I think so. But there are vaccines that are inactivated. Shining out light. I have long COVID. Should I get the vaccine, or if so, which one? So I have discussed this multiple times that long COVID could be multiple reasons. If it is the immune system that is dysregulated, then you take the vaccine or not, it doesn't matter. If it is the virus sitting somewhere and immune system is not able to tackle it, then giving vaccine may boost the immune system a little bit, maybe, but giving vaccine will not harm. So at the end of the day, the right thing is to talk with your doctor to say, here is my situation. Should I take the vaccine or not? Thank you, everyone, for the Covaxin reminder. I keep forgetting that one. William says, question, SARS-1 and any theories on why SARS-1 just mysteriously disappeared versus MERS-CoV is still here many years later? I am very concerned that CV19 will be intermediate host for many years. So MERS-CoV, so I don't know exactly what happened earlier that SARS-CoV-1 did not become this dangerous as SARS-CoV-2. SARS-CoV-1 had all the possibilities, because it binds with the ACE2 as well, to do the same thing. What I have not done, and this is my gap in knowledge, I know that SARS-CoV-1 and 2 are 86% same. That remaining 14%, what enzymes are different in SARS-CoV-2 which make it so capable versus SARS-CoV-2 which was not that capable? So honestly, my answer to your question is that I do not have enough knowledge of this. Priya says, Dr. Bean question, do you think that the microbiome is important in resistance to COVID and long haulers? There was a study that I discussed a few months ago, which said that SARS-CoV-2 may hide in the gut. And then from there, when the pieces of the SARS-CoV-2 through the immune system's behavior there or interaction with the virus, those pieces come to our lymph nodes and they kind of make our immune system stronger against SARS-CoV-2. But microbiome has still not been seen to be something that has to be effective. Because if you think about it, microbiome is actually kind of sitting outside. SARS-CoV is sitting inside the cells. So I haven't seen any study that shows this connection. Marie says that how can something that is not alive, the coronavirus, obey a reproductive imperative? Rocks don't reproduce. Absolutely. Here is the thing. Viruses are not alive, correct? Agreed. This is a philosophical thing, but check this out. Once a virus enters a cell, it has a genetic print in it that can use our cell's machinery to make more of it. So imagine if you have a rock that somehow is capable, is structured in a way that it can enter a cell. So let's say not a cell, a human, an animal, something. So let's use cell, a rock that can enter a cell, then it opens up, and inside the rock is a piece of RNA that can then work, and the enzymes hidden in it that can then work with our machinery. So as long as it is sitting outside the machinery, it is a rock. When it gets into the area where machinery is available, it can get its function done. So that is the basic difference between a rock and a virus. The other thing is that virus actually doesn't know that it needs to reproduce, or it needs. Virus just has a piece of genetic material which accidentally came together with all those enzymes that allow it to reproduce, and now it became a reproducing and replicating thing. I know that many of the people are going to now tell me that this is God's creation and God has made it this way, and who are you to say that this. I'm not getting into evolution and those. Viruses, whoever gave it that capability, universe, God, it got it by itself. There are pieces of the genetic material in it that allow it to use our cells to make more copies of it. It doesn't have the consciousness to say I'm making more copies. It just, that piece of material does that. So that is a difference from a rock. Good question. Audra says that um, if someone had severe complications from COVID and recovered, would they still need the vaccine to be protected in the future? No. If they recovered, then ideally their body has the capability to protect. Now the question is, and I repeat it, I'm sorry, those cool beans who've been with me, you would see this repeating, but look, if from point A to B, let's say January I got the infection, December we are talking about vaccine. If between January and December my immune system's health changed, I developed cancer, or bone marrow issues occurred, or some organ transplant was necessary, or HIV occurred, or steroids were used for some other disease and my immune system has been compromised, or my nutritional status became different, or my B cells got irradiated, and so on. So there can be many reasons my health changes between these 2 points and my immune system is not able to work correctly. Maybe I am diabetic and my diabetes is not controlled and immune system is not functioning as well as it was functioning in January. That is one possibility. In such case, I'll have to need, my immune system is going to need help. The other possibility is that the virus has mutated. Virus changed so much that the virus in January and the virus in December are two different viruses. And January's protection is not applicable to December's virus strains or variants. And so now I need some, either get infected again or get a vaccine. So these are the kind of reasons why this may be necessary to have the vaccine. But if the virus is the same, health is the same, infection occurred, protection occurred, then vaccine is not going to do anything. Mr. J says, Dr. Bean, you're so kind and patient every night doing us this great service. You're very, very welcome. I actually like it. I feel that although I took on this duty, but I think that it is important that we do these discussions. And at the same time, it keeps me engaged with you as well. I enjoy it too. So there is a reward back to me too. Raphael says, question, vaccines so far are called effective based on the antibodies or T cells. No, They're not called effective based on that. They are called effective based on number of infections occurring in vaccinated group versus not. If T cells, that may indicate that the real severe death protection is actually from the T cell and not just antibodies. If I can read your questions, are you saying that the real service? No, so I think I understand your question. The cause of severe disease or death is because of cytokine storm that is usually occurring, observed to occur, more when T helper 2 pathway is active. Now, is it the antibodies presence? Is it an ADE that is happening? Is it the cytokines that are produced in that pathway that are causing this dysregulation? Is it the antibody production is not actually a good thing and the virus just stays on and causes more damage, versus cytotoxic pathway, which seems to handle it well? This is a very good question, Terry. So, Dr. Bean, do you think the efficacy of the J&J vaccine would be higher with the booster? It is possible. It is a very good question. They haven't tested it that way, but it is possible that they give the second dose and now the efficacy is through the roof. You're welcome. Melanie Goodman. Question: if you have an allergic reaction to the vaccine and have to be given steroids, would the steroids given at that dose impact the effectiveness of the vaccine? Not really. So here is what is important. When the vaccine is given, vaccine is going to pick up those local cells there, the dendritic cells and the macrophages, and then it is going to go through the lymph to the local lymph nodes as well. These things are sufficient to have the immune system become ready. The allergic reaction is occurring because there is an allergic reaction. So when you give steroids, they are going to be used up to calm down that allergic reaction. So it is only going to calm it down. It's not going to block the immune system forever. The way to think about that is this: if you have a lots of pile up of cytokines and the cells activation and you want to bring them back to normal, you are giving steroid to try to bring them back to normal. So you're not bringing them down to zero and turning them all off. So immune system would continue to work. The cells would still have the spike proteins in them. They would still make the spike proteins. Immune system would still get trained. Yes, if somebody is in high dose steroid before, during, and after, they may have a weaker response, but they would have a response. Anna says, one drawing is worth 1,000 words. Love your explanatory drawings. Thank you very much, Anna. I love drawing. I was thinking today, so from very young age, I used to love to draw. And today I was thinking that finally my drawing love has combined with my teaching area here in this COVID time and has become useful. Paul says different strains in different places. So one might need different vaccines to travel before this pandemic ends, right? Also, the reason if we had COVID-19, it is possible that, for example, you're going to go from here to South Africa. That seems to be the biggest variant area. So you may have the vaccine here, and then when you're going to go there, there may be a vaccine that is more trained for that area, and now you take that booster over there. Good question. Jan says, Dr. Bean, listening to your session is so calming. I love learning. Thank you very much. And I love having these discussions. Denise says that lymphatic system is so underestimated. Absolutely. The lymphatic system plays a big role in infection and remedy and the vaccine and all of that. Anaga Dalvi says, Dr. Bean, medical lectures, what drugs are safe as prophylaxis during pregnancy against COVID-19? So the folks who have been listening to me for about a year, they know that I am very careful with the pregnant women's situation and children. Neither am I a gynae specialist. And secondly, this is a very, very delicate and sensitive area. So I don't ever try to talk about this area. Having said that, my suggestion will be to talk with your doctor about the supplements, for example, vitamins, and for example, melatonins, or the CoQ10 and NSE and so on. But please talk with your doctor who is specialist in this area, and then with their approval, decide to take it. I have no experience in this area, and the result can be very harmful. So please spare me my apologies. Supplements, vitamin D type things should be correctly done, but talk with your doctor. Rubinia Malone says, Dr. Bean, thank you. I'm learning so much. You're very welcome. Mackay Smith says, Dr. Bean, medical lectures. Question: why have you ignored my question in red to you many times, please? Sorry. Let me go find the question. Where is it? Question in red? Can you please put that question again and I would look at it? Really, I never try to deliberately reject or ignore some question. I even bring up questions that are coming in from trolls and I try to respond to them. So there is no bias here. Amanda says, when will normal people get vaccinated? Will the J&J vaccine hurry that up? Absolutely. That is why I said that now the pandemic is going to go away, because if the J&J comes in the mix as well, then we would have a lot more vaccines. I am surprised that they are still haven't sent enough doses. That I thought by this time, so I'm wrong in so many ways. I thought by this time there will be messages from CVS and Walgreens and other places to say, come get your vaccines. And we will be saying, no, I'm a anti-vaxxer. I don't want a vaccine and I'm not coming in. And they will be asking for people. And here, even today, I received an email about the vaccination in Santa Clara County. And they said, we have been giving it to essential workers and the 65 plus. Now we are thinking of 50 and plus, but they have to be, once again, essential workers, or they have to be high risk and so on. So it's weird. When I looked at the whose CEO today said that 2 billion doses will not be a problem. What the heck? You cannot give us millions of doses that we can administer, and you're telling us that 2 billion doses will not be a problem. So there is a weird gap in what is promised and what is being done. I still am hopeful that logistically these things would just keep improving. Plus, I'm hopeful that majority of the healthcare workers plus the older population has the vaccines, and so the death rates are going to start reducing. So let's see if I have the question again in red from who was the cool bean who was complaining. Mackay Smith. But you might work for Mackay. Please tell me what your question is. I cannot see the question. If there is a question, I would try to answer. Just write it down. Okay, so meanwhile, John Scott says, DPPIV, also be DPP4, also known as adenosine deaminase complexing protein 2 or CD26, is a protein that in humans is encoded by DPP4 gene. Can we work on the idea C19 does influence? Sure. So, John, can you connect with me on Twitter and we can discuss further? Amanda, will when will average people? So that's what we just talked about. I wish soon. Trevor says J&J second dose booster in phase 3 since November. I think data soon. Hopefully, they are bringing in the data. DD says, are there any supplements that increase our T cells? No, but there are supplements that modulate and balance our cells' behavior, including T helper 1 and 2 cells. So please watch some of my early videos where I've talked about various supplements, including vitamin D, which is very important. Marugada says, question, if vaccinated individual can carry the virus post-exposure, can carry the virus post-exposure and transmit the virus to others, does this not suggest the need for 100% immunization to bring this to an end? Margudas, you're correct. The 60-70% immunization and herd immunity is a theoretical concept. It is supposed to bring us to a level where the transmission becomes one only instead of one to many. That means infection still stays there, infection still infects people, but it doesn't infect to the way that it is spreading now. That from 1% to 2 or 1% to 3, it gets down to 1 to 1. Now, would it still be lethal enough? Yes. So this is why you're correct that we'll have to, everyone will have to become immune. And that is when people are all going to be protected. Now, some people are not going to take the vaccines. And so then either they would not get the virus because others have the vaccine, or they will not get the virus because they had become infected and recovered, or they would be at a risk. William Goff says, why do you feel the South African cases are decreasing so fast now despite being a more infectious variant? Because maybe they are taking care of, let's see. This is a good question. South Africa, maybe they become conscious, and so Worldometer South Africa. Oh wow, daily new cases are really down. Beautiful. And look at this. Deaths are still not there down, but these will go down in a few weeks. I really love this that these are going down here. So they have become really down. So what is the population of the country? South Africa coronavirus cases 1.4. South Africa population 58 million, 59 million, 1.4 million infected. So that is not enough immunity at all. How about Bloomberg vaccine dashboard? What is the South Africa's vaccination level? South Africa is somewhere here. So they haven't given the vaccine data yet. So look at this, it's flattening out as well, just like US. So I can only hypothesize, William, that number one, imagine if people have become scared enough of the new variant and now they're keeping away and they're social distancing and they're washing their hands. Or maybe ivermectin has become useful. Or maybe more hydroxychloroquine, zinc, quercetin is being taken. Or a lot of people have become vaccinated. Or the virus has lost its capability to cause enough severe symptoms that somebody goes to a hospital and says, I am sick. Maybe it is actually still going around, but it has become much milder, which I used to say that when it would become more contagious, it would become less lethal as well. So maybe the virus is behaving better. Don't know. I'll do some research. It's a good question. Arun, how can a foreign DNA from virus be incorporated with humans' DNA? Very good question. These are There are some possibilities in some cases that when the virus's DNA comes into our nucleus, it arrives with some sort of enzymes that are able to integrate that DNA into our nucleus. There are so many theories that how can that happen. We can discuss that, Arun. Maybe we should do this as a separate topic, that the integration of the virus or bacterial DNA into our DNA. But most of the time, please remember that if these viral or bacterial DNA would integrate in us and would be there forever, then we will mutate. Our cells will mutate, will become something else. Most of the time, if they do become integrated, they cause destruction of the tissue and the cell, and we become sick. Um, William says, question, I have heard that these new variants cause less asymptomatic or less symptomatic? Marie says, question, by now the American public knows the rules on how to avoid catching COVID. How are the people still catching COVID if they don't live with COVID patients? Do they ignore the rules? Yes. So if I get the COVID, I have somehow ignored some rule to end up with the COVID. For example, I go out every day for coffee, and I do a lot. The Starbucks coffee people, they would always pick up the lid with their bare hands and then they put it on and they press it. And I always wonder if their hands are clean or not. They're youngsters, so they may not even know the symptoms and still be infected. So I come out and I clean the lids with the alcoholic swabs, and then I wet my hands with the sanitizer and then touch the cup and everything. But who knows? I might still someday miss it, or there may be a greater amount of virus that is not cleaned with my try, and it might actually inoculate me. So eventually, anybody who gets it has missed some part of it. Logic says, how effective is prophylactic ivermectin in your personal experience? So far, everyone in my friends, families, patients who are on ivermectin, none of them have gotten it. TD says stopped Starbucks in March, Jim. No. So TD, I actually stopped Starbucks as well. It's only a couple of months that I've started going back since the Starbucks opened up again. And I sometimes talk with my wife and say the coffee might get me killed. I love coffee, and that is why every time when you buy me a coffee, I become so happy that there is a coffee. Merck72 says, hi doc, question please. The vaccine were created with the COVID-19 genome sequence. So now these variants come into play if the vaccine is not programmed to look for variant strains then. So that is a problem. That is where the vaccination or the efficacy may drop. What is happening is majority of the vaccine so far, the front runners, the Modernas and the Pfizers and AstraZenecas and these Novavaxes and the one that we are talking, Johnson Johnson, most of these protein vaccines produce spike proteins. And those spike proteins then invoke the production of antibodies in our body. So when the actual virus comes in with slight mutations, we can still grab onto their spike protein and still react to it. It's just that in the efficacy is now, let's say, down to, like we saw in South Africa, 57%. That means half, almost 43% people will not be able to catch it, and the 57 will be able to. So efficacy is going down. Janet Taylor says, my lungs are only functioning at 40%. My surgery will be 5 hours. It's on my breast. Good luck, Jana. Jenna says this group is huge. Okay, going to get off. Love you all. Love you too, Jenna. Stay safe and protected. Steve Manfred, did you hear about the man in Thailand who was going to be fined for breaking quarantine, but they forgave him because the reason he broke it was he was kidnapped? No, I did not. That is an interesting story. I would read it up. Arun says, "Be careful, sir." What happened, Arun? Did I do something? Oh, for the Starbucks? Yes. So if I did get caught with the virus, then send prayers. Um, Debbie says long haulers recovered or not are reporting symptoms again upon known re-exposure. We do not seem to have good immune response to fight this virus, nor develop good protection. And it is possible, Debbie. Debbie, have you been in contact with Dr. Patterson and Dr. Yo? They have a test lab, test kit. Have you had a chance to use that kit? Susan, actually, you are very correct. I should make coffee at home. Barbara says, heck no, we'll send ivermectin. Thank you. I would love that. This is very good. I saw an elevator today in a medical office building that was equipped with HEPA filters and UVC lighting. I was overjoyed. Beautiful. I have my HEPA filter over here. I don't know if you notice that my cough is gone. Dave WBK says, Dr. Bean, how is it possible that multiple vaccines were developed but not a single mainstream treatment drug? Is that a rhetorical question, Dave? Because mostly there are not much drugs for viruses, right? So antivirals work sometimes, sometimes they don't. In case of SARS-CoV-2, interestingly, we had very early on successes with hydroxychloroquine and quercetin and zinc and then ivermectin. But I would say that it's not that there are no mainstream. I would say these are ignored, suppressed, snubbed, made fun of, and so on. Um, I was very mad when I looked at Emma's November release to say we have now resolved that our suggestion was against our own policy. They did not know their own policy for the whole year, that they are breaking their own policy. And in November, they remembered that, oh man, our own policy, we were breaking it. And hydroxy, we should not stop it. And then things like Sergi Sphere, who came up and created such a damaging report. And then WHO's knee-jerk reaction of stopping hydroxychloroquine. Then Oxford's hydroxychloroquine trial with massive doses that can only kill people. So there was a lot of such things. Now, sometimes I think that Oxford's giving such large doses, I don't think that a doctor will intentionally give bad dose with the intention to kill. Maybe they became so excited that, hey, this works, why not we give it in higher doses to see what happens? But eventually they botched it. They did not think in medical terms. They probably got too excited. Then Brazil's study where they gave chloroquine in such a high dose that it caused arrhythmias and they stopped it. And then that became, well, the Brazil did it. Then remember the Veterans Hospital study, which was also a botched study. So there were some botched attempts, and then there was deliberate ignorance of the possibilities that were available. I still am waiting for someone to come out and say, take vitamin D use ivermectin, do prophylaxis with ivermectin, go get your vitamin D levels checked. We have asked all the labs to do your vitamin D levels within 1 day for free, and go get them checked and keep your vitamin D levels correct, and so on. It's just a massive level of incompetence. Now, what is behind that? Is that a deliberate incompetence, or is that just ignorance resulting in incompetence? I don't know. Some folks say it is deliberate, that, and some think otherwise. Siddhartha says, I read that spike protein has two cleavage sites, S2 and end of S2. S2 end cleavage is what activates S2 for fusion. I had thought it was S1, S2 cleavage that prepares virus for fusion. Siddhartha, I did not know that the S2 cleavage. We know that S1, S2 cleavage has to occur for fusion. So can you send me the link? That's an interesting take. TCS says, I press the like button. Thank you very much. And talking about the like buttons, there is a link for Patreon, and there is a link for buying me coffees, and there is a link for support if you like my work. Over the summer, your vitamin D levels were low. Have you gotten your... Yes. So I started taking 10,000 or 20,000 international units daily for months. And I got my vitamin D levels, and they were, I think, 39 or 40 nanogram. And since then, I have kept up with high doses of vitamin D. Thank you for remembering, and thank you for asking. Sylvia says, Dr. Bean, humidifier and HEPA air purifier helps me with my cough, especially when dry. Absolutely. So I have my humidifier over there and my HEPA filter over here. Although nowadays I do not need it, but I also make sure that the cleaning crew that, for example, who came in today, I make sure that I show them all places to clean. But yes, these things really helped. So Michael Mina still thinks dollar at home test should still be part of... Absolutely. Despite high accuracy, is offset by huge number of tests. Yes, absolutely. We should all... This is a year past. Yes, in 3-4 months, we would have vaccines, and we will be in... All of us would have vaccines, and we'll be much better off. But still, this should become a standard to say, just like glucometer you can have at home, you should have vitamin D levels at home. You should be able to do the testing for SARS-CoV-2 at home. This should just become standard. I do not even understand why they are not, why they're dragging their foot. So Teresa says, can you do a skin test for allergies for the vaccine? That's a good question. I'm not sure, because it's a new vaccine, and maybe they should create a special vaccine part where the RNA is not in the adenovirus, but the remaining thing is there, and they can then use that for allergy tests. Sepal Steve says, where is Luffy? Luffy was here in the beginning of the lecture, and now he has disappeared. I think what happened was, today the cleaning folks were here, and when they are here and they're using vacuums and they're cleaning, Luffy and Kyrie both go and hide, and they don't sleep in the noon time. And so I think he was sleepy, and now he just may have been lying somewhere. Correct, Al. That is correct. Diane, thank you very much for the super sticker. So we are almost 2 hours. If you are okay, we'll continue tomorrow. Tomorrow we'll talk about Sputnik vaccine as well. And so my standard Somebody was talking about the vitamin D and fat solubility that so Wayne is saying, I asked my Jewish friend about kosher food, and he said kosher food is twice the price and half the taste. We're not called the suffering people for nothing. So yes. Okay. So just in general, once again, if you like it, please like, subscribe, and share. And there are some links, especially a new link today in the description for Patreon. So if you would like to help me keep producing these kind of lectures, my originally my belief was that medical professionals need to be more clear about medical concepts so that when they are practicing, they can think about those concepts quickly and apply them. Now we are seeing that this education is actually interesting for all. So if you wanted to support my work, there is a Patreon. And then if you want to buy me coffee, there is a link for that. Or if you just wanted to support my work separately, there is a link for that as well. Thank you very much. And I would see you tomorrow. I just saw from KTK super sticker. Thank you very much. And stay safe and happy and healthy. And I will see you tomorrow. We'll talk about Sputnik.